Tonight in our sports segment, we brought you part one of our two-part series on concussions, focusing on identifying the injury, preventative measures, and some of the effects that can be tested for. Tonight, we take a look at children and concussions, with the focus really being put on teens and youth athletes. With children and teenagers, as in adults, the symptoms of a concussion are similar. But doctors like Moser of the RSM Psychology Center in Lawrenceville are more concerned with the recovery and treatment of kids when it comes to managing concussions.
Typically in the past, people have thought, can you see these two fingers straight? Can you repeat these numbers? And if that was fine, then the child didn't have a concussion. But that's not necessarily so. You can have visual difficulties. You can have some dizziness. You can have a headachy feeling. You can have some nausea. But you might also have some other undetected things such as fatigue, tiredness, not feeling as mentally quick.
Dr. Moser says that children and young adults should be educated about the symptoms of a concussion, but even more, so should coaches, trainers, parents, and those adults that are involved in all aspects of youth sports.
You have more kids involved in sports. You have girls involved in sports that didn't used to be so involved in sports. So you're starting kids earlier. You have more females involved in sports and contact sports, and you're more aware of it. So those factors combined make it appear, and also probably do contribute to an increase in concussion that's identified.
Taking a child or teenager who suffered a concussion immediately out of a game can also prevent a rare but often fatal brain injury called second impact syndrome. This syndrome can occur when an athlete suffers a mild concussion and then within a short period of time, usually within 1 week, receives a second blow to the head before the brain has fully healed from the first hit.
What we're seeing with children is that their recovery rates from concussion may actually be a little longer than adults. Okay. And that also the way they recover may be different. Initially, they may seem that they've recovered, and then a few days later, the symptoms increase. That's why it's important not to return a child to sports too soon.
As was mentioned in part one of this series, baseline tests are crucial to gauge an adult's brain capabilities prior to suffering a head injury. The same goes for children.
Each year, your child, before they go into sports, should have a physical. Part of that physical should really include a baseline testing. Practically speaking, that's not being done routinely right now. I'm hoping that in the future, it will be done routinely. We see more and more schools here in New Jersey and also the Mercer County area making a commitment to providing these programs so that kids can come in and be tested actually at the school site.
As an added note, second impact syndrome affects athletes under the age of 21 more than any other age group, according to Dr. Moser. To find out more on this subject, you can visit her website at rsmpsychology.com.